Knock, knock. Hi, how are you today?
Good.
Wash my hands. I'm good. Put gloves on. My name's Layton. I'll be your nurse today. So we're gonna go ahead and assess your abdomen today. So currently, do you have any abdominal pain?
No.
Okay. What factors precipitate the pain or make it worse? So what factors make the pain? Oh, you do not have any pain though. So
No.
moving on to the next question. All right. So if they did have pain, we would ask them what makes it better or worse, and we'd ask them to describe the location of the pain and any other symptoms that may accompany the pain. And then, have you had any recent weight gain or loss?
No.
Okay. And then, have you had previous abdominal surgery, trauma, injury?
Nope.
Any previous abdominal pain or treatment?
No.
Results of any lab work or gastrointestinal studies? Any lab work done lately?
Nope.
Okay. Do you have a family history of stomach, colon, or liver cancer?
Nope.
Okay. Do you have any? Has anyone in your family experienced appendicitis or hemorrhoids?
Nope.
Or colitis?
Nope.
Okay. Person responsible for nutrition in the family. So do you do your own grocery shopping, or does your mom or your spouse?
Kind of 50-50.
Between?
Mom and me.
Okay. And then, do you smoke?
Nope.
Do you drink alcohol?
Nope.
All right. What does your diet normally consist of? Such as like, what kind of meats?
Steak, chicken, fish, rice.
Any fruits and vegetables?
Fruits and vegetables, yeah.
Okay.
Lots of those.
Do you use any antacids, like if you have heartburn, do you use those?
No.
Okay. Do you use any medications right now for abdominal pain?
Nope.
Okay. Right. Do you exercise?
Yep.
About how many days a week?
5.
Okay. Do you have any cause of stress in your life that affect your eating and elimination patterns?
Nope.
Okay. Any past actions with abdominal pain or problems?
Nope.
Okay. So the patient interview was normal findings, which is good. So now we're going to move on to the physical assessment of the patient's abdomen. I'm going to go ahead and grab my stethoscope because we're going to need it. All right, I'm going to go ahead and assess your abdomen, so I'm just going to have you lay down. All right, so first, I'm not going to expose the client's abdomen for the purpose of the video, but we would normally expose it and actually see their skin. All right, and the client would actually have a gown on as well. So I'm just going to inspect the skin, noting color, vascularity, any striae, scars and lesions. And so I'm going to go ahead and just look at the patient's abdominal cavity. And so the abdominal skin may be paler than the general skin tone because this skin is not exposed to the light as much. Scattered fine veins may be visible, which is normal. New stretch marks, which would be pink and bluish in color, and old stretch marks would be silverly white and linear, are also normal finding. Scars may be pale, smooth, and minimally raised, so old scars may be seen. Abdomen is free of lesions and rashes, and then any flat or raised brown moles are normal and may be apparent. And so now we're going to inspect the umbilicus, noting the color, location, and contour. So we look in the umbilicus area or the belly button area on the client and just inspect and make sure it looks normal. So it'd be right in this area. And the umbilical color and skin tones are similar to surrounding abdominal skins and even pinkish. Umbilicus is midline at lateral line. Contour, it can be recessed or inverted or protruding, but it shouldn't protrude more than 0.5 centimeters. And it should be round or conical. And then we would inspect the contour of the abdomen. And so even with this client's shirt on, we can see that, but we would have their skin exposed. I can tell the abdomen is flat, which is a normal finding. And then inspecting the symmetry of the abdomen. And so we go ahead and look at the abdomen, and either side is symmetrical, which is a normal finding. Alrighty, and then it says that abdominal respiratory movements may be seen, especially in male clients. This client, I'm not seeing too much of the abdominal respiratory movement, which is still normal. It wouldn't be like a super, exaggerated thing. All right, and slight pulsation of the abdominal aorta is only seen in really thin people, and peristaltic waves are also only seen in quite thin people. And this patient is a healthy weight, so we do not see that. All right, we're gonna go ahead and auscultate for vowel sounds, noting intensity, pitch, and frequency. So I'm gonna use the diaphragm, my stethoscope, and start in the right lower quadrant and proceed in a clockwise direction. All right. So we're gonna start in the right lower quadrant. I would normally do this directly on the skin, but I'm not gonna expose the client in the video. Okay. All right, so the vowel sounds did sound normal. And auscultation, the abdomen was normal. So a series of intermittent soft clicks and gurgles were heard at a rate of 5 to 30 per minute. So I did hear some gurgles in there, which is normal. And hyperactive vowel sounds would also be normal. They may be heard prolonged gastric gurgles, characteristic of one's stomach's growling. I did not hear the patient's stomach's growling, but I did hear gurgles, which was a normal finding. So now I'm going to auscultate for vascular sounds and friction rubs. I'm going to use the bell of my stethoscope to listen for bruits over the abdominal aorta, renal, iliac, and femoral arteries. For the purpose of the video, I'm not going to do the arteries just because they can be in sensitive area, but I will do the abdominal or aorta to auscultate for bruits using the bell of my stethoscope. So no bruits were heard, which is a normal finding. So now we're going to use the diaphragm of the stethoscope to look for friction rub over the liver and spleen of the client. Okay. So there was no friction rub noted over the liver or spleen, which is a normal finding. Okay, so now we're going to percuss the abdomen for tone in all 4 quadrants. All right, so I'm going to go ahead and percuss. Okay, I'm going to go ahead and percuss your abdomen. There you go. All right, so the sounds were normal. There's generalized tympany predominant over the abdomen because of the air in the stomach and intestines. There was dullness heard over the liver and spleen. Dullness may also be heard over non-evacuated descending colon. All right, so I did hear the generalized tympany, which was normal. So now I'm going to go ahead and percuss the liver. So I'm going to start in the right lower quadrant, percuss upward towards the chest, and note the change between tympany and dullness. And this will give me the lower border of the liver. Then I'm going to percuss the right upper chest and downward, knowing the change from lung resonance to liver dullness, which would be the upper border of the liver. All right, so I'm going to go ahead and percuss again. Okay. Okay. So the liver does seem to be in the correct position on the client and location. By percussing the abdomen, I was able to hear the difference in the sounds, noting the location of the liver, and it is in normal position. I'm going to go ahead and percuss the spleen. Okay. Okay, so the spleen does seem to be in the correct location. Alrighty, so now we're going to move on to perform blunt percussion on the liver and kidneys. And so I'm going to percuss the liver by placing my left hand flat against the lower right anterior rib cage. Use the ulnar side of my fist and strike against my left hand. Okay, so I'm gonna go ahead and percuss your liver. Okay. So normally the client did not make a face and didn't seem to be in pain. So normally no tenderness or pain is elicited or reported by the client. And I did examine only a dull thud. So I'm gonna go ahead and have you sit up just so I can percuss your kidneys real quickly. If you don't mind just sitting to the side just for the video. All right. Okay, thank you. You can go ahead and lay back down. So the kidney also, the percussion tones were normal as well. So now we're going to perform light palpation, noting tenderness or guarding in all 4 quadrants. And so for light palpation, I'm just going to use my fingertips. Began it in a non-tender quadrant. All the client's quadrants, he did not report any tenderness or pain in any of them. So I'm going to go ahead and just start in the right lower and go clockwise. I'm going to gently lift fingers and move to the next area. Okay. So let me know if you feel any tenderness.
Yeah.
All right.
Nope.
So the client did not feel any tenderness? Okay, so everything looks good. The abdomen is not tender and soft, and there was no guarding. They weren't flexing or anything or moving away. So I'm going to perform deep palpation, noting tenderness or masses in all quadrants. I'm going to use the palmar surface of my hands. I'm going to use the palmar surface of my fingers. I'm going to compress to a maximum depth of 5 to 6 centimeters. So I'm just going to press a little deeper. Okay. I'm going to use the palmar surface. Okay. So I'm going to push a little harder. Let me know if you have any tenderness. All right, we're almost done. All right, so did you feel any tenderness?
No.
Okay, perfect. So the client did not show any guarding or no tenderness was noted, so that is a normal finding. A normal finding would also be mild tenderness over the exphyoid, aorta, cecum, sigmoid colon, and ovaries. No severe tenderness or pain should be noted. No palpable masses were present. I did not feel any masses on the client. So I'm going to go ahead and palpate the umbilicus and the surrounding area just to make sure that it is normal. I'm going to go ahead and just palpate around your belly button. Okay. So all the findings were normal. The umbilicus and surrounding area are free of swellings, bulges, or masses. I'm going to go ahead and palpate the abdominal aorta by using my thumb and first finger, or use 2 hands to palpate deeply in the epigastrium, slightly to the left of the midline. Okay, so it's a normal finding of the abdominal aorta. The aorta is approximately 2.5 to 3 centimeters wide with a moderately strong and regular pulse. Possible mild tenderness may be listed. Now I'm going to go ahead and palpate the liver and noting consistency and tenderness. I'm going to go ahead and use the hooking method. I'm going to stand to the right of the chest. So this would be the right side of the client's chest. I'm going to hook my fingers of both hands over the edge of the right main costal margin. Ask the client to take a deep breath and gently pull firmly inward and upward. Okay. So I'm going to ask you to take in a deep breath, and I'm gently going to pull. Okay. So go ahead and take a deep breath. Okay, thank you. All right, so the finding was normal. The liver is usually not palpable unless it would be really enlarged, and so that is the finding I saw in my client. It wasn't really palpable unless the client is super thin, but the client is a healthy weight, so it wasn't palpable. The lower edge, if the lower edge was felt, it should be firm, smooth, and even. Mild tenderness may be normal. Now, I would palpate the urinary bladder, but due to its location, I'm not going to do that. But an empty bladder is neither palpable nor tender. All right, and so performing the test for shifting dullness or the fluid wave test is only performed if you suspect the patient has ascites. This patient clearly does not have ascites. for my assessment, so we will not be doing those tests. Now I'm going to perform tests for appendicitis. So we're going to look for rebound tenderness. I'm going to palpate deeply into the abdomen at a 90-degree angle, halfway between the umbilicus and the anterior iliac crest, and then suddenly release pressure and listen and watch for client pain. Okay. Okay. I'm going to go ahead. Okay, client does not seem to be in any pain. Or did that hurt?
No.
Okay, so no pain's listed, which is a normal finding. Now referred rebound. So we're gonna do the referred rebound tenderness. I'm gonna palpate deeply in the left lower quadrant and quickly rise. I'm gonna go ahead and palpate left lower quadrant. Any pain?
Nope.
Okay. Now that is a normal finding. If the client did have pain, that'd be a sign of Rovsing sign. So pain and Rovsing sign would be pain in the right lower quadrant during pressure in the left lower quadrant. All right, now we're gonna look at Pessoa sign. I'm gonna ask the client to lie on the left side and hyperextend the client's right leg. Go ahead and lay on your left side. Okay. Now I'm gonna go ahead and just pull your leg backwards, like so. If you could see on the video, bend your knee a little. There we go. Any pain in your abdomen?
Nope.
Okay, so that is a normal finding. If the client had appendicitis, there would be pain in that right lower quadrant. So now we're gonna look for obturator signs. So go ahead and lay back on your back for me. Now we're gonna take the client's right leg and we're gonna support the right knee and ankle and flex the knee and hip. And flex the hip and knee and rotate the leg internally and externally. Go ahead and go like this. Okay, I'm gonna flex it this way.
Okay.
And then this way. I'm gonna do this one more time. Any pain in the right stomach
Nope.
or abdomen? Okay. So no pain was elicited, which is a normal finding that the client does not have appendicitis or they would have experienced pain in the right lower quadrant. Now we're gonna do the hypersensitivity test. I'm gonna stroke down the abdomen with a sharp object or grasp a fold of skin with my thumb and index finger and quickly let go, and do this several times along the wall. Okay, so I'm gonna go ahead and pinch you a little.
Yeah.
Okay. So the client does not seem to be in any pain. Was that painful?
Nope.
Okay, which is a normal finding. So the client feels no pain and there's no exaggerated sensation. Now we're going to go ahead and perform the test for cholecystitis, the Murphy sign. So I'm going to assess the right upper quadrant for pain or tenderness, which may signal cholecystitis, inflammation of the gallbladder. So I'm going to press my fingertips under the liver border at the right costal margin. Ask the client to inhale deeply. All right, go ahead and inhale deeply. Any pain?
No.
Okay, which is a normal finding. So since there's no pain, there's no indication that there's cholecystitis present. All right, so that concludes our physical assessment of the abdomen. I would take my gloves off, wash my hands, and escort the client out. Okay, thank you.